Okay, it is 11 o'clock. I don't know if you have time for more questions or if you want to go to your survey.
You know what? I'll take more questions, but in the meantime, just in case people have to leave, I will launch it.
Okay.
So I'm opening the vote now. Okay, great. So yeah, it's open, and there are 5 questions. The 4 first ones are, you have to choose if you agree, strongly agree, neither agree nor disagree, or disagree, etc. with the statements. And the 5th one is just asking you about how this presentation, if it has had an impact on what you'll do in the next 3 months. So please fill this out. It's really important information for us, and for Seniors Action Quebec, we'll be sharing the results after.
Yeah, it's very helpful to all of us. Thank you. Ruth made a good point here I want to bring up so everyone who isn't reading the chat box can see it or know of it. She recommends or says that it would be great if a pharmacist can provide a current list of medications that a person is taking. She says she always has to ask for it. So I think she's suggesting that ideally you wouldn't have to ask for it, that your pharmacist would give you an updated, maybe every time you have a new prescription, and that it's a good thing for somebody to carry around either in their purse or have easily accessible at all times in case you do find yourself in a conversation where these things are an issue. Okay, there are a few other questions here. I'm trying to read my handwriting. Janice brought up a thing. She asked that if you could repeat and go over the cognitive behavior training, CBTI.
Yeah.
If you could repeat the name and just expand a little bit on that.
Right. So what I will do, I don't know if I put, okay, let me show you a slide here. That's another one of my slides where we saw, I don't know if you see my mouse, but on the right-hand side, there's a handout called How to Get a Good Night's Sleep Without Medication. So CBTI is, as I mentioned, about training your body to learn to sleep naturally, retraining it. Because with time we become, if we're using sleeping pills, we become accustomed and we think we need them. And as I mentioned, we stop them and then we have insomnia, and so it starts off again. So what we want to do is put in place these strategies, and CBTI works on a few different things. Firstly, it helps you manage if you have running thoughts, anxiety, etc. It uses meditation for that and other strategies about those running thoughts, because I realized that it can be something that can have an impact on our sleep. Then it talks about sleep hygiene, so how to make sure that we are in the best conditions when we go to bed, in terms of the room, the schedule, how we really integrate sleep into our lives and the routine, avoiding caffeine after whatever noon or things like that. And in terms of keeping a sleep diary, all of those components of the CBTI is in this brochure. So when you get to the website, deprescribingnetwork.ca, that brochure, by the way, was developed by the Research Institute at the UGM. So it's been developed by a geriatrician who's a doctor for older adults, a specialist, and her team. So once you get to the website, you go on resources for the public and you'll find it there, and it has it all there. So you can work through the different steps. It's summarized, it's succinct, and you can kind of really discover all of the different components of CBTI.
That's super interesting. And I imagine some of those things are applicable to other issues that people may struggle with. A couple people, and this again has come up from a few people, and there's sort of different questions worded, but all sort of come around to how do I approach, or how am I supposed to communicate with a doctor who isn't providing alternatives or what I feel is complete information on the medications I'm taking?
Mm-hmm. So if we feel like we're not getting say the response we are looking for, the answers we're looking for, or just the attitude isn't there for, in some cases, for some of the health professionals, what I always try to say is, okay, so maybe the first time wasn't the right one, but if we're trying, you know, I know there's a certain limit to the number of interactions we can have with a doctor, then maybe turn to another health professional in your circle that could assist you with that discussion. So either your pharmacist or another health professional. So if the doctor isn't necessarily responding, you could just really share in the same way that someone would share their thoughts with someone who's over medicated and thinks that someone's over medicated and shares their feelings. You can just say, you know what, I'm concerned that I may be taking too many meds. Is there something we can do about it? So if I realize that if you get, pushed away, or if they don't recognize that there is an issue there, which is problematic in itself, because you're the patient, you're the one taking these meds, you're the one taking the final decision at the end. So then if you don't feel like you're listened, then turn to your community pharmacist really and talk about this with him or her, and have them, because they can communicate as well with your doctor. And I'd say the family doctor is like the quarterback of health, right? They kind of bring everyone together, because the specialists kind of gravitate and focus on a specific condition. But yeah, if you have other health professionals involved, it's always good to seek a second advice if you feel like you haven't been listened by the first.
Yeah, I think it's a resource that a lot of people don't think about,
No.
that your pharmacist, has this expertise, and it is part of their job to help you and support you and make sure that you understand what you're taking. So what you're saying though is that the pharmacist can also advocate or speak on behalf to your doctor. If a pharmacist was to see something in someone's sort of prescription files that concerns them, what are the steps that you take?
So once if the pharmacist sees that there's a problem, it can be, acute, like, the patient can't take the antibiotic, it interacts with another medication, or it can be something like, you know what, you've been on the sleeping pill for 5 years, 10 years, we should try to reduce it gradually. The pharmacist now has more, with the new bills in place, has a leverage of activities that they can actually initiate by themselves, but they're always going to integrate the doctor in a decision. So it's a team approach. It's not going to be in a silo and the doctor will not know about it. So what they're going to do is they're going to contact your doctor either by phone. If it's acute, like if you can't take an antibiotic, they'll likely be calling the clinic. But if it's something that's, say, doesn't need to be solved right there and then, they likely will, believe it or not, fax. We still use faxes. I don't know if that'll change in the near future, probably, but for now it still relies on fax machine, and they will fax the clinician, the doctor's office, and have that suggestion. So it depends. Some of the pharmacists are closely located to the doctor's office. They have a good channel of communication. It really depends, but it is their role, and they are paid for this, to actually connect with the doctor and provide a suggestion, a replacement therapy, or a plan to taper off a drug. They are paid for that.
That's great. And what role, you mentioned earlier that if somebody has, they want to review their medication, that nurses are also an option. What kind of role can a nurse play if you can't reach a doctor?
Yeah, so in the clinics, it really depends on the family group. So there's nurse practitioners, obviously, that I have not specifically mentioned, but there are more and more of them are involved in the family medicine group. So they're as equipped, they can look at your medicine and prescribe, deprescribe. They have the whole breadth of activity that a physician can lead. And in terms of registered nurses, RNs, they have, for example, they do diabetes monitoring. So if you're seeing a nurse for other type of education, you can ask them your question. Now, will the nurse say, oh yeah, we should stop your medication right there and take the initiative? No, probably not. But they are the right person to be sharing your thoughts with and really discussing these issues. Perhaps the nurse maybe has more of an ear and can listen to your concerns and then talk about it with the team. So really consider that all the members of the team are there to help you, and they play it's such an important role. And we're seeing them, a lot of our members at the network are nurses, and they're the ones who know the patients the most. Like in hospital, we see they're the ones that like the doctor maybe comes in and leaves quite quickly often, but the nurse is there regularly. So really talk to them and share your thoughts, because they can be the one then saying, you know what, maybe that's caused by a medication, and be the person who makes the difference in the team.
Yeah, I think it's important. I think you bring up a good point that, you know, it is a team. And so if you don't have access necessarily to a doctor, or you don't have a doctor who's listening, that doesn't mean you should, you know, stop trying to raise your concerns or stop reviewing what you're taking, because it's serious. And I think a lot of people trust their doctors implicitly. And while it's, you know, it's great and you should trust your medical professionals, you also should be educated and, you know, try to do your best to take care of yourself, because you are your own best advocate. You are the one who can take the best care of yourself with your partners in medical care.
Well said.
Yeah, thanks. So I'm not sure, that sort of rounds up the biggest questions, and I think we should probably wind it up here. So thank you so much. Camille, is there anything you want to add before we bring this to a close?
No, thank you to everyone. I see people have filled out the survey, so that's great. So in terms of after this presentation, I know that I'll be in touch with Ruth, and we'll be sharing with her some of the resources that I've shown, as well as the link to both of the websites, so deprescribingnetwork.ca and medstopper.com. So dive in, and yeah, I'll be looking at the questions in terms of the ones that we haven't had a chance to talk about. So if I can be in touch with you, I will.
Thank you so much for your time. I do want to take a moment and thank Ruth Pelletier for her incredible hard work on putting this together and making sure all of you knew about this. It wouldn't have happened without her. So a big thank you to Ruth. And Camille, thank you so much for your time. I could talk to you for another 2 hours, because it's such an interesting topic, and I don't think people think about it often enough. So I really appreciate you coming.
Thank you so much to the team and to Ruth, yes, for sure, for being such a champion for this this topic, this cause. So it's great to have the chance to collaborate with you guys.
All right, well, thanks everyone. Any last comments or questions coming up in the chat box? Oh, Ruth has left her email if anybody wants to get in touch with her. So, but we will be reaching out. And as Camille said, she's going to have a last look at the questions. So thank you. If there's anything, you can email us at info@seniorsactionquebec.ca. And I wish everyone an excellent day. Thanks very much.
Thank you. Bye-bye.
Bye.